lots of people will be looking for it in the morning. So I just wanted to make sure everyone knew that here. So we'll get started. Good evening, everyone. Thank you so much for joining us tonight. My name is Laura Caruso, for those of you who don't know, and I'm the Executive Director of Pelham Together. We're thrilled to host the second community discussion on the coronavirus, and again with a fabulous panel of local experts. Not only are they medical experts in their fields, but some of them are fellow parents and or caring for Pelham families in one way or another, and we're very lucky to have them, so thank you. We are about to approach 1 year since the beginning of the shutdown due to this pandemic, which was an amount of time that many of us could not even fathom last March. So while at our November panel, we focused on the holidays and the cold weather, now the landscape is really more about variants and vaccines, new questions and new considerations, which is why we pulled together a second panel. We received a number of questions in advance, and thank you for your submissions. We've combined and grouped the questions by theme, and I'll ask different panelists to weigh in on different questions. In the interest of time, I'll ask our panelists to be mindful of time in their responses and ask for some leniency in being able to move the conversation along. In order to cover as many of the submitted questions as possible, we will be responding to some by way of the chat, posting links to resources and websites. So for example, Eileen is going to put in the chat now some links to sites for vaccine sign up, which cover some of the questions that were submitted in advance. If questions do arise during the session, please use the chat function, and if time allows at the end, we will do our best to get to them. I'd also ask that if anyone in the audience has found a particularly helpful resource, to put those in the chat for everyone else to benefit from. We have received some questions regarding the reopening of schools. And while some of those are better addressed in another forum, we are asking our panelists to comment on the science-based questions, appreciating their particular backgrounds and expertise. And finally, this session, as I mentioned, will be recorded and made available in the morning on the Pelham Together website. Tonight, we are very fortunate to have Dr. Tracy Breen, Chief Medical Officer at Mount Sinai Hospital, Dr. John Cahill, Chair of Global Health, Infectious Diseases, and Emergency Medicine at Mount Sinai Hospital, also the CDC Site Director for Emergency Infectious Disease, and the Chief Advisor to the United Nations for Infectious Disease. Dr. Ada Huang, Deputy Commissioner of Disease Control for the Westchester County Department of Health, Dr. Pavrithra Mandappa, Clinical Psychologist with the Child Welfare Services Program at the Westchester Institute for Human Development, and Dr. Jessica Simpkins, Pediatrician at WestMed Medical Group in New Rochelle, caring for many Pelham families. Our themes for tonight, our questions fall under these themes: vaccines, variants, immunity, and children. So I'm going to start right in. We have lots of questions and I want to get to as many as possible, if not all. So starting with Dr. Cahill. Our first question, Dr. Cahill, if you've had COVID or if you test positive for antibodies, can you receive the vaccine? If so, how long do you have to wait to get the vaccine after having had COVID?
Yeah, so the answer to that is yes and yes. So whether you've had COVID before or have antibodies, you absolutely should get the vaccine when it's your time to be eligible. If you meet criteria now, it's basically once you're clinically over COVID and don't have to quarantine anymore. So the simple answer would be 2 weeks. And we don't use antibodies as part of our decision pathway on whether you should be vaccinated or not. Bottom line is the vaccines there, all three right now that are available look very promising. And when it comes to your turn, you definitely should be vaccinated.
Okay. All right, Dr. Breen, anything to add to that?
I would just comment in terms of if you've already had COVID. I know some people have questions. Well, I have personal antibodies. Does that mean I don't need a vaccine, or I already had COVID? Is it worth it? Again, all the recommendations are yes, right? I would not consider being personally sick or having antibodies enough to protect you. We're not sure what that means yet. So since it doesn't preclude you from getting the vaccine, and we don't know how much protection it offers you, and we do have good data around the vaccines, I definitely recommend people go ahead and get the vaccine.
Great, thank you both. The next set of questions are a series regarding the safety of the vaccine in different scenarios. So I'll ask three of you to weigh in on three different scenarios. So again, Dr. Cahill, can you please speak to the safety of getting the vaccine if you have a pre-existing condition, such as an autoimmune condition? And specifically, someone asked about factor V as an autoimmune condition. Is it safe?
Right, and it's important to understand that these vaccines, all three that are available, are inactive or not live vaccines. And certainly if you have an autoimmune condition, you're at higher risk to develop COVID, and factor V included in that, you're better off getting vaccinated as opposed to deferring and not being protected. The one downside about some autoimmune diseases is your immune system might not have as brisk an uptake to the vaccine, but still getting COVID is certainly much more serious in someone with an autoimmune disease as opposed to any risk for the vaccine. So risk versus benefit, absolutely people with autoimmune diseases should get vaccinated.
Okay, thank you. Another scenario.
I'll say one last thing, I'm very sorry. The CDC just came out today, basically the only contraindication to getting the vaccine is if you're allergic to a prior dose or allergic to the ingredients that are found in the vaccine. So I just want to mention that.
Yeah, thank you. Thank you. Dr. Breen, how about this, speaking to the safety of getting the vaccine, getting a mammogram after having the vaccine? Is that safe?
Yes, that's a hot topic, because what
Yes.
we're finding, and actually my office mate had this happen to her. She got the vaccine and then she had horrible lymph node swelling in her axilla and her armpit. So we're seeing that because it is a pretty robust immune response people are having. It's not uncommon for people to have lymph node swelling as part of that. And actually, there have been some recent released recommendations, I think, from radiologic societies recommending that if you are, first of all, if your annual mammogram is due, please get it. People deferred a lot of things last year, so it's safe to go in. There's safety protocols everywhere. Please go and do your health maintenance things. But if you're going to do it before your vaccine, right? Because you might have these findings. And if you are going to get your mammogram after your vaccine, it's probably going to wait about a month or two, just to make sure there's not a false positive finding on that mammogram, because some of them will show up as in a large lymph node, but it's benign, it's not harmful. So that's reassuring.
Thank you. And Dr. Simpkins, can you please speak to the safety of getting a vaccine if you're pregnant?
Yes. So it's complicated, of course, because we still don't have the data. Unfortunately, pregnant people were excluded from the initial studies, so it's going to take us some time to get that hard data that says that it's truly safe. We do know the risks of COVID during pregnancy, including higher likelihood of ICU admission and higher likelihood of having a premature birth. And so far, there have been no red flags for getting the vaccine during pregnancy. Many vaccines are given during pregnancy routinely, and there's no reason why the specific type of vaccines that are currently released would be any different. None of them have any red flag concerns that we wouldn't want to give them to pregnant women. So many women who are pregnant are getting the vaccine, and so far we don't have any data on that, but we should expect that probably later this summer.
Okay, thank you. Next question, again related to vaccines. Dr. Cahill, how long after the second dose does one have to wait for its full effect? And can a fully vaccinated person transmit the virus? For example, this person's asking, or several people asking, if we're visiting grandparents and they're fully vaccinated, do we still need to worry that they may transmit the virus to us?
Right. So to answer your first question, it's felt that 2 weeks after you receive your second dose, you probably are well protected. And if you want to be conservative, you could stretch it out to 4 weeks. But generally speaking, 2 weeks after your second dose, you felt well protected. In the scenario, if the question that the grandparents are already vaccinated and you're vaccinated, it would be very unlikely, not impossible, that any of you would acquire COVID from one another. Now, what we don't know is the vaccine. We do see people getting vaccinated still could be asymptomatic carriers for COVID, and we don't know what that means yet. But we haven't seen, put it this way, so far, we haven't really seen scenarios where people vaccinated have been traced back to actually giving COVID to someone else. But, as more people are vaccinated, we'll have a lot more data on that.
Okay. So it's a little too soon to know that, really.
Yes.
Okay. Dr. Breen, anything to add there?
No, I would just say that, the theoretical risk that the hypothetical risk we're talking about are vaccinated people walking around with asymptomatic, colonization, and whether or not that's transmissible is yet to be seen. But I think it's very reassuring, but we're going to know a lot more in the next couple months, right?
Okay. Okay, thank you. Dr. Simpkins, we received this question quite a few times. Once grandparents are fully vaccinated, is it safe to hug their grandchildren? Can they be around them, the grandchildren, without masks? And is it safe for the grandparents to be inside our home if we have not been vaccinated? So it's a whole package of grandparent questions.
Yes, and I think of them really as the same question.
Yes, that's
grandparents be around without masks, right? Obviously, the hug being the most important part.
yes.
So this is obviously an emotionally loaded and tough question to answer. Just like Dr. Cahill was saying, we can't ever say that there's no risk. But I think the most important thing to remember from the vaccine trials is that every single vaccine that is out there right now has prevented all cases of severe COVID and all deaths from COVID. So if you have a grandparent who maybe has one chronic condition, but isn't extremely frail, they are very unlikely to have a case of severe COVID once they are vaccinated, and again have reached that point of full vaccine effect. So 2 weeks after Pfizer and Moderna, and I believe 4 weeks after the one dose of Johnson & Johnson. So I do think you have to evaluate your own risk in some way. Make sure that you're being honest with yourself about how high of a risk your grandparent is, but they are definitely at a much lower risk of having severe COVID. Could they still have a mild case of COVID? Possibly. Again, it's very unlikely, but there were a few cases in the trials, but none of them progressed to severe COVID, and that's the true goal of vaccination. We should also be mindful, like was said before, that they could carry the disease into the house. So if you yourself are high risk, that might be a point of caution, or if they could bring it back home with them to somebody else who lives with them that isn't vaccinated. Again, just trying to think through all of those things as we've done so much for the past few months. But of course, like the health benefits of being with family and friends, the physical and mental effects of the isolation that we've felt the past few months are significant. And so if you could weigh those risks and you're feeling better about it, I think after you're fully vaccinated would be a better time to do it. And obviously taking standard precautions, if anybody is sick at home, not having anybody come over, just like you usually would. Treat it more like a cold and flu season rather than COVID as far as people who are vaccinated.
Can I make a plug for the hug? There was a great article in the Times that came out a couple months ago about how to hug safely. Did anyone read that? It was we need to talk about that, right? I mean, I'm sorry, but a quick hug, you're masked, I'm masked, we're both looking away, quick hug, we're back out, I think there's a lot to be said for the quick hug. And I think there's a way to hug safely if that's in your personal risk profile that you're willing to take in. I know my mother-in-law was very happy when 2 weeks post-vaccine, I gave her the blessing with a mask to hug each child very quickly.
Yes. Yes, I from the number of times we received a question along these lines, I wholeheartedly believe that there are a lot of hugs that are needed out there. So thank you.
There's a lot of immune suppression that comes from the trauma of being isolated. So there's real true physical effects from what we're going through right now.
Right. Right. Now, Dr. Mandapa, do you want to weigh in on the benefit of a hug at this point in terms of people's mental and emotional health?
You cannot overestimate, I think, the benefits of a hug. I think physical contact is such a part of attachment. It's such a big part of communicating affection and feelings for someone else. It's been hard, I think, for a lot of people, obviously immediate family, but also with friends and, with kids, just being able to reach out and touch somebody else. I can't wait till we can get back to the point where it can be a safe greeting again. Yeah.
Yep. Thank you. Next question, Dr. Huang, can you please discuss the side effects of the vaccines? And are there different formulations producing different side effects?
Sure, thank you. So all vaccines come with, side effects. And I think the most common side effect with this vaccine, as with all the other vaccines, is really just what we call a local reaction. So a lot of people get pain and redness, and soreness. But these vaccines are associated with what we call systemic effects. So there is a fairly significant incidence of people who end up feeling fatigued following this vaccine. Also, I think headache is pretty common. And there are some people who get chills and fever and muscle aches. But for the most part, I want to say, at least with the Pfizer vaccine and with the Moderna vaccine, which are the mRNA vaccines that are out, there is a higher incidence of having these side effects after the second shot, as opposed to the first one. But most of them are transient in nature and they resolve fairly abruptly. So there are some side effects, but again, they do resolve.
And you're not seeing a different set of side effects between Pfizer or Moderna?
No, I think they are pretty similar in that regard. I do think that from the data that from the most recently approved vaccine, the Johnson & Johnson vaccine, that there is a somewhat lower incidence of side effects. But of course, we don't have the experience with that yet because it's just now becoming available.
Right. Thank you. Dr. Cahill, anything to add there in terms of your experience with the side effects?
Yeah, just that both the Pfizer vaccine and Moderna have about equally same side effects. There's no big difference if you compare one over the other.
Mm-hmm.
The other thing just to remind people or comment on is more than usual, we're seeing people having delayed reactions, which aren't necessarily dangerous, but they'll come down with side effects 7-10 days after receiving the vaccine, which is a little unusual. Most people, if they're going to have a systemic reaction, occurs within 48 to 72 hours. But not of concern, but just a little bit different in regards to, we'll see people say, is it possible that I'm having a low-grade fever or a rash or a headache, a week after being vaccinated? And the answer to that is yes.
Okay, thank you. Dr. Huang, is the case rate dropping due to vaccines? And do you anticipate that all healthy adults younger than 65 will be fully vaccinated by September? And even, more recent headlines suggest possibly by late spring and summer. So first, to comment on the case decreases, the case rate decrease, and the expectation of vaccinations.
So the good news is anybody who's been watching this, the case rates are decreasing, certainly from, very high levels that we saw in January. And so they are much lower now, and that is very, very encouraging. And I think, as somebody said today, though, there is a difference between progress and success. So I think we are making progress in that our case rates are coming back down. And at the same time, we are able to vaccinate more and more people. And with increasing time, it should get even better. But I think one of the things we do just want to be cautious about is the next few months we really are at a critical juncture while these case rates keep coming down and while we're able to get people vaccinated. I know one of the other topics you're going to be talking about is the variants. And the higher the case rates are, the greater the risk and the greater the likelihood of coming up with these variants. And these variants are a bit of a curveball in terms of how well the vaccines are going to work, how quickly we can get the case rates back down. So we are really trying to emphasize at this point, to continue to exercise caution. And when you've been vaccinated, we're still really saying it's very important to mask, to social distance. And as you know, there's a lot of discussion, right now on what should be done with quarantine for people who've been vaccinated. I don't think that this is going to be a long-term thing, but I think for the short term, we're really encouraging people to be patient, continue with all of these measures until we can see where things go. Now, with respect to the vaccinations, I think the news is very encouraging. Even, in the last 6 weeks, we've heard about so much more vaccine becoming available and all sorts of, measures to try to increase the production. And I think you've probably all heard the president say that he anticipates having enough vaccine for every adult in this country by the end of May. So I think if we can keep track on that, I think there is a very good chance that we can get most people vaccinated, certainly by this, sometime this summer. So we're trying to be optimistic about this, but at the same time, we are really trying to encourage some caution and not to rush into things.
Okay, excellent. Dr. Cahill, can you weigh in on the possibility of all healthy adults under 65 being vaccinated by May?
I think that's what we should work for. I think realistically, it's probably going to be longer than the spring, probably more towards fall or even early 2022. But we are making wonderful progress, and the quicker we can vaccinate people, the less we have to worry about variants, and the quicker we can also build up herd immunity. So just push forward as best we can.
Right, well, that's an excellent segue to our next section on variants and one of our questions on immunity with regards to herd immunity. Dr. Breen, this question reads like this. Can you please explain the efficacy of the existing vaccines against the currently known variants? Will the vaccines need to change as more variants are discovered?
Very good. Easy answers. No and yes, meaning we don't have great data, right, around the variants. I think we have a lot of reassuring data that the current vaccines are effective against many of the variants, maybe not as effective, right, as the original strain that we saw. But just to really echo Dr. Huang's comments, right, variants come out because there's a big pool of virus and people in them to replicate and change and morph, right? The quicker we get that potential pool of mutation down through vaccination, lower case rates, social distancing, the better off we'll be. And now again, individually, there's only so much we can do to affect that, but I just think that keeps supporting the message that this is a little bit of a longer haul that we're in for. But I do think that so far, the data against the variants is looking pretty good. Does that mean that we won't have to redo the vaccines going forward? Maybe, right? It may be that there's got to be an annual or a seasonal refresh or reboot, not that dissimilar to what we do for influenza, a little bit different. But that could come out. And again, as we've said in other venues, we're going to be talking about COVID for a long time. I don't think it will be, limiting us to the extent that it is right now, but we're going to be learning and talking about it for a long time.
Okay, thank you. Dr. Cahill, with respect to immunity, once vaccinated, how long does immunity last? And when will the US achieve herd immunity?
So unfortunately, we don't know how long the vaccine is going to last. In my opinion, I could see it being more of an annual vaccine, and we might adjust it just like we do the flu vaccine. And so I think that's something that, we're just going to have to wait and see how long the vaccine is effective for, but I doubt its long-term effectiveness and probably needs to be more annual. herd immunity, the quicker we vaccinate people, the better, and the quicker herd immunity will occur. And I would say, we probably need to have a rate of about 70% of the country vaccinated to achieve any type of good herd immunity.
Okay. Okay. There has been some, I have seen some things written estimating that the immunity on the vaccine could be as little as 3 months. But you suggest it's likely an annual amount of immunity, 12 months worth.
It could be as less as 3 months, but the reality is there's no way we can vaccinate, our population every 3 months.
Right.
And, we'll know a lot more in the next couple of months as, we just started vaccinating people last December. So we're only into a little bit over 4 months here now. So.
Right.
I think we know it's at least as much as 3 months, right?
Okay.
So we've
Yeah.
got good data 2-3 months and up until 3 months. And now we're really seeing how long we think that's going to last.
Okay. Thank you. Dr. Huang? And the next
Yeah,
question
I was
is,
just no, I
yes,
was
please go ahead, add to that. Yeah.
that the 3 months is there because we only have 3 months of data right now,
Right.
and that's putting that limit. As we follow it longer, it very well may be that they will continue to extend that length of time. But as Dr. Cahill said, I don't think anybody knows, what
Right.
the long-term, duration of this immunity is. We're just going to have to see.
Okay. Dr. Huang, if you would take this one too. This question is COVID here to stay like the flu? We've touched on this a little bit already, but just getting directly to that issue.
So I think there's a lot of differing, opinions about this. And I guess what I would say is, given how widespread this is, which is similar to the flu, it is hard for me to imagine that this is something that we're ever going to completely eradicate. I do think it is here to stay with us for the duration. I'm hoping that what happens with vaccination and as people, develop immunity, either from natural infection or more or hopefully more from vaccination, that it will become milder with time. And certainly, we all have to hope that it's going to have less of an impact in terms of mortality and hospitalizations. But I do think there's a very good chance that it's likely here to stay and that we may be requiring regular vaccinations, for this.
Thank you. Dr. Simpkins, with case rates dropping, what activities are safe to do? What behavior is riskiest this winter with some people vaccinated, but most not?
So the case rates are definitely dropping from their extraordinarily high levels, but that we do have to remember that a lot of that was driven by those holiday get-togethers that we knew would drive the cases up. So where we're at now, we have to remember that we're only at the level of our second peak in July, which at that time was our highest peak, and we were very concerned about it at that point too. So even though, like someone said before, even though the case rates are dropping, we are still not at a low transmission rate, and so there is still COVID out there. So really, the same ideas apply, especially as we get into the warmer weather months. Outdoor activities are definitely safest. If everyone can be relatively spaced out, not in such a clustered area, then having masks off is an option. It's still better to have a mask on, especially if there's any risk of close contact between people. Anything indoors, still fully masked and hopefully at low capacity. I still wouldn't go to like a packed wedding with no masks and dancing, but I think we still have some rules on that in place. And I think just being cautious as we start to reach that herd immunity is reasonable, but once we get to the point where rates are very, very low, that's when we could start feeling more comfortable with taking our masks off, being indoors, but we are still pretty far away from that.
Right. Dr. Breen, you had some pretty good suggestions when we were talking about the holidays and how to balance what was reasonable with our kids. And I wondered if you could weigh in on this in terms of a sense of what's risky right now, despite the fact that case rates are dropping.
Yeah, I think case rates are dropping and that's all good. But as was just said, it's still out there. I think this is all springtime optimism, right? So what good things are coming? It's getting warmer. There's more light. There's more outside things happening. We can start gathering socially again outside. I think we have to do all that again and think about ventilation inside. And I would still recommend that people mask inside and follow those guidelines. I think what the vaccination hopefulness gives us is a relief of this existential angst and fear that we have. Like it's like this weight being lifted off us. That's what I personally vaccinated, scores of people, which was the best part about the whole last year, I have to say. And for every vaccine that I gave, it's like you could see this weight come off this person, right, as they went off. And we would say, you still have to go and follow all the safety precautions, but you don't have to have this fear and dread weighing on you. And I think the tension is going to be, as that comes off us, that we're going to want to open up and do all these things. I think the recommendations are still the same. But I would still make a plug for the brief, quick hugs, because I think we can't be. I really do feel like we can't be so fearful that we're not also being logical and recognizing what true risk is.
I love that you said that, because we should feel good that the masks help us to do most of what we want to do. The masks are a really good thing that lets us feel relatively safe in most scenarios. You still want to be cautious, but they're a good tool to use.
Thank you. That's a great segue into our next section on children. And Dr. Mandapa, this definitely is a place to pick up on that sense of the hug. The first question is, what do you imagine will be the long-term mental health effects of the pandemic on our children? And more specifically, people are asking about what can parents do to mitigate the social and emotional effects of remote learning on different ages of children? So it's a two-part question there.
Good question. So we'll start with the long-term impact, right? I think it's really hard to have a definitive answer to that. Right now we're still in it. So a lot of what children are going through, parents are going through, communities are going through, it's in the present. So it's really difficult to extrapolate from that. I mean, obviously we're expecting, at least in the mental health community, we're monitoring kids that we know are at risk and, making sure that things aren't getting worse. But it's really difficult to say that there's going to be a long-term impact for a large number of kids or all kids or, things like that. I will say, children have such a range of, or such a capacity really to process stress, right? And if there are buffers in place that can help them, buffers that relate to family, buffers that relate to relationships, I think that, we'll see different people come out with different outcomes. We're going to have some kids who are going to 5 years later look back and say, oh my God, that was a really strange time. Like, do you remember? Like, we were standing out in the freezing cold, 6 feet apart, trying to have a conversation. And you're gonna have some kids say, that was a really hard time. Like, I lost a lot of people. They'll remember the grief. They'll remember, being separated, not being able to see grandparents. And so it's difficult to kind of come up with an overall long-term impact. I will say for children who currently are vulnerable, children who are high anxiety, children who may actually already be a little bit afraid to go into crowded spaces. It's going to be an adjustment. We've seen this kind of qualitatively with kids going into school. You have some kids for whom that kind of going into that classroom, even socially distanced, is indoor. It's not something they're doing kind of outside of school, and it's hard. And I think when we reopen schools fully in terms of in-person, whenever that is, I think it's going to take an adjustment, a mental adjustment for kids to kind of reacclimate to proximity and reacclimate to, having conversations in larger groups. And so, I think the best thing we can do is really buffer our kids right now with as much kind of relational closeness that we can give them. I think getting creative with how they're in contact with other people, whatever their age is, whether it's, more frequent calls to grandparents, whether it's, being creative with outdoor play dates, because there are ways to do things safely. There's a lot to be said for thinking outside the box. And so I feel like that's where we're at now. It's, we can hypothesize about some of the things that might come out of this, but it's really going to be hard to make kind of a blanket statement about that. For the second part, this has been a really hard time. 1 year of all kinds of changes. I don't think we've never really been in this situation. So, to tease out remote learning and the impact of that is virtually impossible, because there's so many things going on and there's so many overlapping kind of factors. One thing that stands out, I really think, for social emotional health is isolation, right? Separation from relationships, the way we've known them. Doesn't mean that we can't find new ways to connect and relate, but that takes time. And to be honest, our communities have done a really good job of coming up with ways to have children stay connected. I have 2 children who go in hybrid and they go in person to school, and they love the days in school because it's kind of actual interaction, but they've also found really creative ways to connect on the days that they're doing remote learning. They are loving the breakout rooms. They're getting very creative with technology. And so, again, I feel like it's not something you can tease out and say, this is what is going to impact students and, things like that. I'm not speaking about the academic piece. That's not my expertise. And, that's a whole different conversation. And in terms of, age ranges, I feel like we have different challenges at every developmental stage. So you have young kids who, again, everyone's going through a time that they're not prepared for, right? There's this added layer on top of what anyway is hard work. Being a kid and growing and developing is naturally filled with obstacles that you have to overcome, developmental tasks you have to master. I think for younger kids, in some ways, it's a little bit, not easier, I guess is the wrong word, but they look to parents and they look to family for connectedness primarily. Even if they're in school, they get their comfort and their support mostly from family and parents. And so I think that's the place where we can really mitigate some of the impact of the isolation, set up a structure. I feel like it's really important for parents to not kind of fall back on it's COVID and kind of dropping expectations. I think there are certain expectations that really help children move on to the next stage, whether it's a small success or a small mastery or a bigger kind of negotiation. Parents need to keep doing that, keep to the structure, keep to the expectation. There are certain norms that as human beings, we want our children to follow and certain skills we want them to develop. I think those things don't change because we're in a pandemic. For young children, being able to learn things and being able to show off those things in family, kind of acknowledging that, because whatever is going on in the world, children are still learning and growing, right? And they're still, it may not be in typical ways, but they are learning things. School age children, like I have a 9-year-old who is scanning things into Google Classroom and uploading PDFs and, doing things that I would never have expected him to do last year. So there is growth, and I think it's really important to acknowledge that growth so children have a sense of movement, especially younger children. For school age children, again, it's about mastery, like their whole kind of focus, in those younger elementary years is really what they're learning, and not just academic learning, but creative learning. What are some things they're getting better at doing? What are some things that they can navigate successfully that they couldn't 2 months ago? And a pandemic is a really good time to learn to navigate things because we're kind of forced into the situation where we have to find ways to do stuff. Again, I think for school age kids, the same rules, stick to a known predictable schedule as much as you can, create opportunities for them to learn new things. Do new things with them. And I know it's easier said than done. I'm a parent, I work full time at 5:30 sometimes. I don't have the time nor the energy to sit and work on a puzzle. So one of the ways we've dealt with that is that we just set up things around the house as much as space will allow, and then we spend 5 minutes on it or 10 minutes on it together. Or sometimes all we have energy for, both the kids and us, is to hang out in the same room. And do whatever we're doing but it amounts to stuff, all those little things. And so I think, that's a way to kind of beat some of that isolation, right? Like, we're all forced into the same space, but it doesn't always have to be forced. You can still kind of create opportunities. For teens and preteens, I think it's a little bit more complicated. They look outside of family for support. They look outside of family to process emotions. They look outside of family for kind of social acknowledgement and affirmation. So I have a 12-year-old, and it's been a learning experience, and she's not very extroverted, but it's one of those things that I feel we've had to push ourselves as a community and as parents of, young children or children that age to say, well, how do we do this? And how do we do this safely? Because we are not going to be enough for them, right? The teenagers are going to need something other than parents and a sibling. Or, not that they don't need them, but they're going to need more. And there's, again, been a lot of, creative thinking from around, like, people that I know, really trying to find ways to help children maintain kind of those connections and form new connections. I think that should really be our goal at this point. There will be academic kind of concerns. Some will be founded, some won't. But I think, again, for parents to be able to separate kind of their stress and their concerns about their children from the children's stress and what they're experiencing is really important. We know babies who are held too tight feel the anxiety from the mother, and it starts like right in infancy. And so you have kids who are really picking up and watching your every move. If you're kind of concerned and worried and communicating that all the time to them, I think they pick up on it, and then they start fearing kind of vague things, right? That's the danger, because as a parent, you can articulate, this is what I'm worried about for my child. Your child is going to pick up on all of that worry, but they're not going to be able to actually tell you what the worry is about. And then it generalizes to, they fill the gaps. We know young children, I mean, they fill in the gaps with what makes sense to them, or in a way that to help it have some meaning for them. So I think there's a real risk in kind of communicating or over communicating your worry and stress. It's really important, I think, for parents to validate fear and anxiety and kind of just the feelings of being stuck, like nothing's changing, we've been in this for so long, and really be able to then normalize some of that and say, no, you're absolutely right, like this situation is awful, and I don't blame you for feeling this way, and kind of also generating a sense of hope. Things have moved. It's been a year, and it's been super frustrating and very demoralizing and isolating, but we have seen movement, with the vaccines coming out, with the fact that we were able to go back in school 2 days a week, with the, over the summer, I think kids were able to stay a little bit more connected to friends. And I think pointing out that those things are also happening, not just kind of negating the bad stuff, but taking both of it into consideration, I think is going to help kids kind of have more of a balanced view of, yes, it's terrible right now, and there have been some other things that have also happened.
Right.
Yeah.
Thank you. Thank you. I really appreciate you pointing out that things can also be small. We're 5 minutes in a room together with a puzzle. If that's what you can do, there's benefit to that. So that's helpful as parents have, varying degrees of time to feel like they're building some of that resilience that I know you are a big proponent of. Thank you. Dr. Simpkins, the next question under the category for children is, how prevalent is COVID-19 in children, and what have been the primary symptoms in young people?
So based on the US data only, the prevalence of COVID in kids, and this is positive tests, so we know that the numbers are truly actually higher because many people don't get tested, especially in the beginning of the pandemic. So about 4% of children have tested positive, And to compare that to adults, adults are at about 8.7% as of today. So there is some selection bias there because adults are more likely to have severe symptoms than children, and probably are more likely to get tested. I do think some kids are getting tested more because if they're in person in classrooms and things like that. But other than that, they might have mild symptoms and not go in for the test. As far as the primary symptoms, it's a little different depending on the age group. So dividing it into below age 10 and above age 10, from age 0 to 9, most common is fever, number 1. Second would be cough, and third would be headache. Down from there is diarrhea, sore throat, muscle aches, nausea, vomiting, runny nose. Shortness of breath is all the way at the bottom for the younger kids, and then loss of taste and smell is very uncommon for that age group. Very different for the age 10 to 18. They tend to get headache as the number 1 symptom. I was surprised to see that in the data, but that's what they are showing, followed very closely by cough, and then fevers, muscle aches, sore throat, and then shortness of breath, diarrhea, loss of taste and smell is down there, and then followed by nausea, vomiting, runny nose. So a little bit different depending on the age group. As far as hospitalizations, about 1 to 2% are hospitalized. And as far as the numbers we have now, it's about a 0.04 fatality rate. So that's very, very low.
Thank you. Thank you. Dr. Cahill, the next question is for you. Can you please update us on the vaccine trials currently underway for children? When will, in your estimation, will a vaccine be available for different age ranges, like 16 plus, which I know is current, 12 to 15 as another age range, and anyone under 12?
Right. So currently, both Pfizer and Moderna have started clinical trials in older children, 12 plus years of age. And both are estimating that they should have data from those clinical trials. This is the first stage of the clinical trials by midsummer, and perhaps by as early as 2022, there actually might be a vaccine for 12 years plus. It's probably going to be much longer for younger children, just because even though we're always careful with vaccine development, particularly with children, we tend to be very, very careful and conservative when doing clinical trials on vaccines. But there are 2 going on in the United States right now, and we'll, by midsummer, hopefully have some good news and data from that. From my own experience, one would expect that hopefully the immunogenic effect will be as successful in the adult population. That's been reflected so far. But once again, time will tell, and this summer we should have the initial data out.
Okay, thank you. Dr. Huang, anything to add there, or?
No, I think, that's about it. The trials, unfortunately, are going to take a little bit longer before, we have additional data, on children, but hopefully we'll get there. And at that point, we will be able to vaccinate children as well as adults.
Thank you.
The only thing I would add to
yes,
that
please.
is the nice thing is once the data on the kids comes up, the emergency use authorization is going to go much faster, right? So it's really just that will probably just be a tack on to the EUs they already have, or EUAs they already have. So that at least is reassuring, because it means as soon as that data comes up, it's kind of like off to the races.
Right. Thank you. This one is for any of you with children. Many of our audience members would like to know if you will give the vaccine to your own children. Thumbs up for cousin. Thumbs up from Dr. Breen.
I've got 3 kids. If I had 3 thumbs, I'd have 3 thumbs up there.
Okay. Dr. Cahill?
I won't vaccinate my own children, me personally, but I will make sure they get the vaccine.
Okay.
So absolutely.
Fair enough. Fair enough. Dr. Mandapa?
Absolutely. I think if we have numbers like we saw for the adult vaccines, definitely.
Okay. And if you had children, anyone, Dr. Simpkins?
Yes, eventually we'll definitely vaccinate. If the vaccine's approved, then that's going to mean that it showed really good safety data. So I'm going to feel good about that once it comes out.
Okay.
And I
Thank
do
you,
believe
Dr.
Johnson & Johnson is looking at looking at testing all the way down to newborns. So just wanted to add that on too. I think that came out this week.
Which is
Yeah.
exciting, you know, and
Yeah.
actually full disclosure, I called all my infectious disease colleagues to find out if there were any clinical trials happening in the New York region, because I was going to sign up all my kids, but just so everybody knows, there's no clinical trials for kids happening in New York because I already checked it.
Checked.
They're not.
Okay.
That is up-to-date information. Thank
Yeah,
you.
hot off the press.
So I have three,
Dr. Huang?
yeah, I have, my children are grown, but I do have
Mhm.
3 of them, but I absolutely would have them vaccinated.
Okay. That is a universal plug
Yes,
for
Yes,
the
they're not
vaccine.
eligible yet. They're not old
Yeah.
enough. and Thank goodness they don't have any comorbidities, but
Right.
definitely.
Okay. Thank you. Dr. Huang, actually, this next question. Can you please share some of the most recent scientific studies on the effects of 3 feet distancing versus 6 feet distancing?
That is the question du jour. I think
Mhm.
been asked this question by every school superintendent, head of school, and plenty of parents in the last, I don't know, several weeks or whatever. And I guess the quick answer is, you know what? We need more data. That's really what it is. We really need more data on what this shows. But just a little bit of background. I think the origin of the 6 foot, recommendation that CDC and the state health department and most others, have recommended is actually, based on studies that I think from quite a while ago, where they looked at other, infectious diseases that are spread in a similar fashion, other respiratory types of infections. And the feeling is that most of these kind of particles or, aerosolized droplets that contain infectious particles would drop to the ground within a 6 foot radius. And a lot of that is really from healthcare or settings, in studies that were done in a healthcare setting. And so that came up, as being the recommendation. And so the question, of course, now is, does it have to be 6 feet or can it be less? I'm not really aware of any good solid data, and I don't know if anybody else, on this panel is aware that whether there is systematic data. I think one of the problems that we're dealing with is that this, even though it feels like forever, this virus is relatively new. And so therefore there's just many, many, many unknowns about it. And so could it be less than 6 feet? It could be. I just don't think we have enough data. I do want to just, backtrack a little bit about that is when, this all started and when we were bringing the kids back into schools, I don't think anybody really had a good sense, of what was going to be safe, and nobody wanted to jeopardize that. And certainly in the case of the flu, it's known that there is a lot of transmission, or that is a source of spread of a lot of these infections. And I think everyone was very concerned that we didn't want to see the same thing happen with COVID. And so the recommendation was made for 6 feet. And those of you will recall at the beginning of the school year and all of the first semester, whenever there was an infected person in the classroom, the recommendation was to consider the entire classroom exposed and pretty much exclude them from school and subject them to quarantine. So the very good news was from that first semester, we actually did not see much at all in the way of transmission in the classroom setting. And so that led us after the Christmas break or after the holiday break to change that and basically loosen up on that and say really only people who are within 6 feet would be considered exposed and subject to quarantine. I know that, a lot of the schools, due to space constraints, are, interested in decreasing that distance. And I think we are really going to have to see how that is. But one thing I do want to say is the low rates of transmission that we have been seeing in the school setting are really contingent on all the measures that were in place. So everybody was masking, everybody was 6 foot apart. there was cleaning, there was hand hygiene. We've tried to increase ventilation. Now we have an additional tool at our disposal, which is trying to get all the teachers vaccinated. We can't get the kids vaccinated yet. And hopefully with all of those things, we will do better, but I really don't think we have any information right now, to say whether, what's safe and what's not safe in terms of a minimum distance. And again, we're just trying to urge patience, and, caution,
Mhm.
right, until we can lower the rates further and get the vaccination rates higher.
Thank you, Dr. Wang. Dr. Breen, I wonder if you could elaborate on that with respect to the 3 feet versus 6 feet distancing if we're adding eating to the scenario. I know we spoke about this the other
We
evening
did.
on the task force.
All these COVID conversations are blurring
Yes,
together,
we blur
right?
together.
So,
Yes.
And I always struggle. So the 3 foot, 6 foot thing, it's so maddening, right? Because as Dr. Huang just said, it's not like we have great data. And sometimes when we don't have great data, the absence of data doesn't also prove that it's not safe. It's just an absence of data, right? And so I would just say that there's a lot of variables that go into that. Things like the air quality, the ventilation, right? You could be 6 feet apart, but in a really tight room with no air movement. I would probably pick being 3 feet apart in a bigger area with better air movement, right? So it's not just the space, it's a whole bunch of other factors that go in, including the masks, right? Our primary, we talk about our defense mitigation strategy. It's like mask. It's like, it's all of it. So I think that one of the things we talked about the other night, obviously I run a hospital and we have to go to work and people have to work in close proximity and they can't socially distance. So the experience, and again, all the experience that we're sharing, it's all anecdotal to this point, right? We're sharing as we learn, even the getting kids back to school and seeing very reassuring low rates of what we think is in-school transmission, essentially kind of zero in our area. This is all anecdotal learning, but it's still powerful. So the anecdotal learning I will share with you is that getting staff back together, working in a very high risk situation. We've had a very small number of what I would say hospital exposures or outbreaks. And the vast majority of those were related to staff kind of in break rooms, not following the masking guidelines, right? So these were staff who were interacting with really sick patients, and as long as everyone was masked, they were fine. But they go and they share like a sandwich with their colleague, right, in a break room without their mask and talking, and that's where the talking comes down, right? So we think about what are the things that increase the risk of air spread. Singing, right? Joyful noise, right? Raise a joyful noise. Singing, talking, laughing, all these things, right? They put out a lot of breath. So the difference between eating quietly versus eating and talking, I think that's something we've got to think about. Eating is a very social thing. It's really hard to eat next to someone and not talk. But again, I always tell people, if I can see your mouth going like this, we're not safe, right? I don't want to be able to see anybody's mouth going like that in my space. So that I think is probably going to be one of our biggest challenges going back to school. I'm less concerned about the desks when they're all like in their masks and everybody's safe and not singing. It's more about how they're going to be eating.
So I do want to mention that with respect to eating, like the guidelines for considering who's exposed, we do extend that to be a bigger perimeter. It's obviously impossible to be masked while you're eating and drinking. And so I think, as all the schools are familiar with, for a lunchroom setting, we do, for example, if you are in the classroom and you do end up eating lunch in the classroom, we will consider the whole classroom exposed in that situation. But if they're in the cafeteria or the lunchroom, we will go for a further distance. We're not limiting it to the 6 feet because, just as Dr. Breen said, you're not masking, you are talking. And so there is a greater risk there.
Right. Thank you. All very difficult things being considered right now. So the last question in this category, Dr. Simpkins, I wonder if you could start us off, and Dr. Cahill, if you could add, with regards to summer activities, as everyone's looking forward to that time of year. Will children need to wear masks outdoors, at camp, for instance? How about the rest of us when outdoors? And are swimming pools safe?
So I feel like sound like a broken record, but it's definitely still the same guidelines. And it's not, I'm not laughing because it's a silly question in any way, because it's not. It's going to be summer and we will feel a lot safer being outdoors. So for activities that can be separated, then there's less of a risk without wearing a mask, but most of the time masks will be a part of our life. I think masks at camps are going to be definitely in place. I think it depends if you're talking about sleepaway camps versus day camps as well.
Mhm.
So I would expect that at sleepaway camps, they're going to have to create like household cohorts within each bunk. They might have certain rules about who spends time with each other unmasked. So I think each camp and probably each state, honestly, will have different rules based on what they mandate there. The outdoor activities, we can expect them to be masked, especially if they're mixing with other kids. And then as far as pools go, there's no evidence that COVID spreads through water. So I think it should, and especially if it's treated with chlorine, disinfecting agent. So swimming pools are basically as safe as any other outdoor activity, as far as we know at this point. So as long as distance can be maintained, then it's relatively safe to be there without a mask. I would be very wary of a packed public pool, because that's the same thing being in close quarters with other people.
Right.
Yeah.
Dr. Cahill? Yeah.
I agree exactly, completely with everything Dr. Simpkins said. And particularly, masks are not going to disappear even when people are vaccinated within the next year. It's still we're going to have to follow all the rules we've been trying to enforce now. And with swimming pools, once again, it's limiting how many people are in a pool and social distancing when you're in the pool. It's not the water that's putting you at a higher risk. It's how close you get to someone in the pool.
Mm-hmm. Okay. Right. And obviously I think overwhelmingly the message of, masks tonight, we couldn't say it enough, but it also relates to a couple of the questions that have come in from the chat. And although we're at the end of our time, I'll just, people are wondering, even with the levels of vaccination going up, will we still need masks? And it seems like from everyone's answer, largely yes, in the classroom, I should say. And then in terms of planes, what about if a child is too young to wear a mask? Is it safe with a critical mass of vaccinated adults and people have tested negative? Is it safe for a young child to travel on a plane without a mask? Dr. Breen, do you want to take this?
I'll take first crack and then I'll hand over to Dr. Simpkins, the pediatrician. There's just no zero risk here, right? There's no zero risk. And again, we've talked before, we take risk every day. I take risk crossing the street. I take risk getting in a car. There's risk in everything we do. So you understand your own personal risk tolerance, and figuring out ways to make things safer, right? I think first of all, the risk to a child who's 2 of contracting COVID in an ever low case rate world, I think that's reassuring. But that's when I hand over to Dr. Simpkins to talk about the safety risk of a toddler, right?
Yeah, and as we know, the younger kids are very low risk of having complications. They have relatively mild COVID. Maybe they do have a bad fever for a few days, but for them, it turns out to be more like a regular cold and flu season. So as long as all of the adults around that child are vaccinated and that child potentially carrying the virus could not bring it to another person who was not vaccinated for whatever reason, I think that's where the real risk comes in. With any cold and flu season, there's always a risk of children getting complications from viruses, and we should probably treat it about the same as we do a regular flu season.
Thank you. Thank you. Dr. Mandaba, could you just bring some closure for us with this question? What advice can you give to people to keep them motivated through this last little bit of winter to get us into spring and summer?
Yeah, I'm a little bit biased because I do love winter and I love the season, and I think there's so much great stuff out there. But I'd say get out more. I feel like especially with your children, because children aren't that prone to feeling the cold. I think the older we get, the less tolerance we have to that. So I would definitely say get out more. I would say, make time for yourself in the winter. And again, like I believe in really small doses of self-care. You don't have to, go for, I mean, it'd be great to go for a massage for an hour, but you don't have to. You can do a 5-minute, 10-minute self-care routine. You can make sure you have your cup of coffee by yourself. I think it's important for adults to get that alone time. Like we've talked about, everyone's in the same house. We're all working, we're all doing school. I mean, there is a lot of crowding in some ways that we're not used to. So I think that that's, important to do. I think, using this time to make new traditions is a great way to keep motivated. Is this something you could do every year? COVID, no COVID, being creative about what you do as a family, I think is important. And we've had some, I think activity planning, we've kind of outsourced it in the world we live in. We have somebody and we send kids to do many things. I've seen some really creative ideas. I had a friend who put together a virtual sleepover for all of our daughters, and that went over really well. They all it was like parallel play for young children, but everybody's doing masks, and it was really genius. And the kids didn't question it. They had a really good time. So like thinking outside the box, it is going to end, right? We know spring always comes and it is going to get warmer. The tulips are coming out, doing things like a photography walk, making things fun, I think is really good. But again, just having each person taking that time for themselves and being aware of where they're at emotionally, just to push through, I think the next 6 to 8 weeks is going to be really important because we're all fatigued. I mean, this is, yeah.
Yeah. Thank you. Thank you so much. Thank you to all of our panelists. We've come to the end of our questions, and as I promised, anything not addressed or links to resources will go out to everyone who registered, and the recording will be available in the morning. We truly appreciate all of your time, to our panelists and your thoughts, and thank you for all the ways that all of you right now are truly taking care of people through this, including this community, by being here tonight. Thank you to Leah Tabaz and our programs committee at Pelham Together for pulling all of this together. And thank you to all of you for attending and your thoughtful participation by submitting questions. We'll follow up with the links, and I really hope everyone stays safe and well. Thank you so much. Good night.
Thank you.